Welcome. Today, we're taking a critical look at the dark side of the American healthcare system. This is a deep dive into the challenges faced by millions. The U.S. healthcare system is often touted for its innovation, but beneath the surface lies a complex web of issues that affect patients and providers alike. The American healthcare system is vast, involving intricate relationships between patients, providers, insurers, and pharmaceutical companies. While quality care is available, our focus today is on the systemic flaws, exploring the financial, accessibility, and ethical problems that many Americans encounter. One of the most immediate and painful issues is the exorbitant cost of healthcare in the United States. We are seeing unprecedented levels of soaring medical bills and escalating health insurance premiums, making essential care unaffordable for many working families. The resulting financial burden is severe, leading to a medical debt crisis where unexpected illness can quickly wipe out savings and drive average Americans into bankruptcy. Despite being one of the wealthiest nations, the U.S. healthcare system lacks universal coverage. Millions of Americans remain uninsured or underinsured, meaning even with coverage, deductibles and copays are too high to afford necessary treatment. Limited or no access to care leads to poorer health outcomes, delayed diagnoses, and preventable suffering, especially for chronic conditions. The system is notoriously complex, often baffling even those with good insurance coverage. Patients must navigate a maze of complex insurance forms, opaque billing practices, and the devastating threat of surprise medical billing for out-of-network services. A significant lack of transparency means it's nearly impossible for patients to understand the true cost of care or what their insurance actually covers before receiving a bill. The for-profit nature of the American healthcare industry fundamentally shifts the priority from patient well-being to financial gain. Huge pharmaceutical and insurance companies exert massive influence, driving up prices and prioritizing shareholder value over accessible healthcare. This profit-driven model often results in necessary treatments being delayed or outright denied by insurers to cut costs, putting lives at risk. The American healthcare system is plagued by significant disparities in access and quality of care. Access and quality often heavily depend on socioeconomic status, race, and geographic location, leading to worse health outcomes for marginalized communities. There is an unequal distribution of healthcare resources, with rural and low-income urban areas often facing severe shortages of doctors and specialized facilities. In conclusion, the dark side of American healthcare is defined by immense costs, lack of coverage, paralyzing complexity, and deep-seated inequities. We've highlighted that while the dedication of individual medical professionals is commendable, the overall system structure presents enormous barriers to affordable and equitable care. It's time to demand systemic change to ensure healthcare becomes a right, not a privilege, for all Americans. Get informed, get involved, and advocate for a better system.